You've probably heard about professional athletes or celebrities using PRP to recover from injuries faster or even rejuvenate their skin or hair. Your body has this natural ability to heal itself. It's so powerful, but sometimes that healing process needs a boost. It gets stalled. So PRP provides exactly that boost. We take your own blood, we spin it in a centrifuge to separate out the platelets, growth factors, and cytokines. All the things in your body responsible for healing. And we inject that concentrated platelet-rich solution back into an area that needs some healing. For professional athletes looking to extend their careers and to busy parents who just want to chase their children around without pain, this has been life-changing. So today we're going to be diving into some really exciting advancements in medicine, specifically platelet-rich plasma or PRP. And we'll touch a little bit on stem cell therapies as well. These treatments fall under the umbrella of regenerative medicine, a really cool area that's revolutionizing how we approach prevention, preservation, injury recovery, and joint health. First, let's talk about PRP. You've probably heard about professional athletes or celebrities using PRP to recover from injuries faster or even rejuvenate their skin or hair. But what exactly is PRP and how does it work? Your body has this natural ability to heal itself. It's so powerful, but sometimes that healing process needs a boost. It gets stalled. So PRP provides exactly that boost. We take your own blood, we spin it in a centrifuge to separate out the platelets, growth factors, and cytokines. All the things in your body responsible for healing. And we inject that concentrated platelet-rich solution back into an area that needs some healing. Platelets are packed with growth factors and proteins that kickstart and accelerate tissue repair, making PRP particularly effective for joint, muscle, tendon, and ligament injuries. Think of it like this. Say you were to scrape your arm. What would happen the next day? Your body would start to heal itself with little scabs. These are your platelets signaling this healing. PRP has 8 times the amount of platelets than in your blood. So you can imagine how powerful this can be for healing. We inject that concentrated platelets into the area that needs that healing. Common conditions that respond exceptionally well to PRP include rotator cuff tendonitis and partial tears, ACL sprains, tennis elbow and golfer's elbow, also known as medial and lateral epicondylitis, patella and Achilles tendonitis, osteoarthritis, and even some chronic tendonitis. I've seen remarkable recoveries in patients who thought their chronic joint or tendon pain was something they'd have to live with forever. It's incredibly rewarding to see these patients regaining their mobility and quality of life with this natural treatment that's all coming from their own body. Now, I want to be clear, PRP isn't magic. It's not an overnight fix. You will not walk out of that procedure pain-free immediately like sometimes you do when you have a corticosteroid injection. But usually within about 3 weeks, patients start noticing improvements. With PRP, your own biology does the heavy lifting and it speeds up your natural healing process. And because we use your own blood, it's one of the safest treatments available and the most natural, and it has minimal side effects and excellent outcomes. I often have patients that come to me and they don't like the idea of using a corticosteroid. It has a really bad rap. I actually think there is a place for corticosteroids in some small doses and over longer periods of time. But there are side effects. If you have diabetes, it can increase your blood sugar. And also, over time, putting cortisone into a tendon or into a joint, it's actually going to weaken that tendon and make the cartilage worse. So because of these reasons, patients nowadays are really coming to see me to ask for alternative modes of therapy, and I think PRP is one of the best ones. But PRP isn't your only regenerative medicine option. Stem cell therapy is another groundbreaking treatment that's transforming joint and tissue repair. Stem cells, you need to think of them like the body's raw material. They're undifferentiated cells capable of turning into various specialized cell types your body might need. Whether it's cartilage, muscle, or ligament cells, stem cells can adapt to help rebuild that damaged tissue. Stem cells are typically harvested from your own body, from the bone marrow or the fatty tissue. Sometimes are also sourced from donors. If you're getting it from your bone marrow, the typical place that we get it from is from your pelvic bone. Fatty tissue is also super powerful. This actually has 10 times the healing of platelet-rich plasma. There's a new procedure where we harvest the fat in your flanks and your belly. Unfortunately, not enough to make a difference in your waist size. But we take that fat, we purify it, and then we put it into the joint. And it's even more powerful than the PRP we talked about. So these stem cells, they're prepared and injected directly into damaged joint or tissue. The therapy is especially effective for more severe injuries or chronic conditions like advanced osteoarthritis, where the body's natural repair process has fully stalled. Like PRP, stem cells are also not an immediate fix. Recovery and improvements generally start appearing around 3 weeks after the treatment, with continued healing happening over several months. One of the major advantages of stem cell therapy is that the benefits sometimes last longer than those from PRP, making it a really good choice for those with significant joint degeneration or chronic pain. So you might be wondering, how do you know which one of these treatments is right for you? I typically tell my patients to start with the PRP. It's the most cost-effective. There's not a lot of downtime. We can do it right in the office. Takes about 15 minutes to complete. PRP is often the best fit for mild to moderate injuries, acute conditions, or when you're looking for a boost in healing speed. Stem cell therapy, on the other hand, is definitely more costly and is typically recommended for more advanced or degenerative conditions, especially where tissue replacement or regeneration is needed. It's also important to understand that these therapies are not a one-size-fits-all solution. Your physician can also not make any guarantees. They work best when combined with lifestyle adjustments, including proper nutrition, hydration, and structured rehab exercises. Your recovery will significantly benefit from staying active and focusing on overall wellness, enhancing your body's natural healing capabilities even further. Now let's talk about aftercare. So you come to my office, you're getting some PRP, we draw the blood, we inject you right in that same visit, and you're walking out. What do we do now? With both PRP and stem cell treatments, taking a brief rest period after injections is crucial. I also like to tell my patients we're creating an inflammatory response. So all those things we do to decrease inflammation, like ice and NSAIDs, we want to avoid those things in the first 3 weeks. In fact, you may actually have some more discomfort than you had before the injection. Healing can only occur when there's a period of inflammation. Also, avoiding smoking, alcohol, excessive caffeine, these can further support your healing. The incredible thing about regenerative medicine is the safety profile. Because PRP and stem cells and the fat cells, they all utilize your own body cells. So there's a significantly reduced risk of adverse reactions compared to synthetic treatments like cortisone. That said, like any medical treatment, your outcomes are going to vary based on your age, overall health, and the severity of your condition. You will definitely know more about its efficacy around 4 to 6 months post-injection, but in my experience, I've rarely seen patients that feel no effect. It's usually 50 to 80% better. These cutting-edge therapies have opened new doors for countless patients who believed chronic pain was just something they were going to have to live with, as well as that limited mobility. For professional athletes looking to extend their careers and to busy parents who just want to chase their children around without pain, this has been life-changing. Regenerative medicine offers tangible, life-changing results, and the next step is to get these covered by insurance because right now they are only out-of-pocket procedures. If you're struggling with chronic joint pain, tendinitis, arthritis, regenerative medicine might be the path to a stronger, more resilient future. It's exciting to witness these advancements firsthand and share them with you, empowering you to reclaim your health and live the vitality you deserve. Remember, your body has amazing potential to heal. Sometimes it just needs the right tools. That's what resilience is all about. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.